Uh, Good evening, gentlemen. This time I am presenting my our software VBON Vita, uh, which is related to M Health. So it is basically a clinic management software. So I'll tell you what area we are basically focusing on. The big hospitals, they have their own HMS and HIS. They manage their data. But nowadays there is a trend of for every hospital, the doctors are on consultation. They call them and they visit. Even the doctors visit more than one hospitals, and even they have their own clinics. So for specifically those doctors, what happens is it's very hard for them to organize their data, means their own patient data. Nowadays, most of them are doing it through either Excel sheet, or directly noting it out in a register or copy. So we are focusing basically that segment. I'll skip the initial slides. I start with the evolution of healthcare information technologies. So in 80s it was PMI. It was having limited functionality, and the standalone applications were there. Interoperability was literally nil, and the basic focus was on financial transactions and back office work. Then in 90s, then came the health informatics. Then again, applications were standalone. The functionality was extended to an extent, and the interoperability was very limited. And similarly, it goes to EMR in 2000s, and 2010. It's the time of e-health. You get the patient gets its electronic medical record, and the functionality is good, but it still has room for improvement. And up to 2015, we are focusing on smart e-health, and we are focusing on adding mobility to this healthcare environment. So our idea for this work was extending healthcare beyond just the health centers and make them the patient oriented, means empower the citizens and patient to carry their records with them. This will help them in their keeping their track of their own medical history and everything. And the motivation factor was basically the extensive use of mobile technologies that is going on in today's scenario. Now everybody is having a mobile phone. Every other person is having a high-end phone, not only just high-end smartphone or the phone with GPS connectivity. So this is the software Clinic on the Go. You can see it is displayed on a laptop and a tablet device. The laptop is the online version you can access via web browser, and the tablet is the offline version. So the data whichever a doctor is storing is in this tablet version will be stored on the tablet based on the its memory capacity, and they'll have an option to synchronize it online. They'll get a license key, they'll get a user ID and password. If they want, they can access it via web or via tablets if they buy tablets. The facilities are the patient management, the system to search the patients, manage their things. They can schedule appointments, the lab reports can be updated, billing is the easy thing. Then the prescription can be digitized. If they are using tablet, they can simply use a stylus to write the prescription also if they want. Messaging can be given to the patients if required, and the test reports and the data especially, which is there on cloud, it is kept in high security. So this time we are having basically three versions already out in market. One is for general practitioners, one is for pediatrics, and one is for diabetologists. The fourth version we are working on is on dental, and it will be out by April 1st or 2nd week. This is the launch ceremony that happened in Delhi. Yeah, so what are the challenges for the doctors right now? So whatever solutions they are having, they are either complicated, means if they want to manage, say, the billing data, if they are entering it into Excel sheet, first they need to have a total command over Excel so that they can generate all this data, all the graphs and charts. Then the patient information is not very organized as of now, and it is not very easily accessible by a patient. Then if the appointments are mismatched, then the loss of revenues may result. And if the last point is specifically keeping in the focus of some small clinics, some doctors individual clinics, if they want something on their own, just like big hospitals, it can cost anywhere between 3 to 15 lakhs, and plus the downtime costs and other things. So what our solution does, first of all, the cost effectiveness, the solution costs about 20,000 with the tablet device. Then it can work on any tablet. If they are not interested, let's say in Samsung Galaxy Tab, if they want an iPad, they can get an iPad. That's not an issue. Then there's just one click dashboard where they can manage for everything: EMR, patient management, whatever they are doing on this tablet. It will be stored in the cloud, and it can be accessed whenever they are creating a new patient record. They are entering mobile number, and the patient will get an SMS, and he can use that mobile number and the link in the SMS to access his data. Then if they want, they can connect to the other hospitals, diagnostic centers, and yes, if they want, they can organize the loyalty programs and campaigns. The option for sort of advertisement is also there. So this is a brief overview of the productivity solutions. As I said, the doctor can use stylus, and the printing can be done by a small printer or anything. Then on the lower side, the first one is the interface, which is available on tablets. The second one is actually a DICOM viewer. What doctor can do if they are having if they want to visualize some reports, let's say it's an MRI data, so they cannot not every time they'll need to have to go to their clinic and get that sheet and then observe it, right? So they can just use and we have some hardware which allows this data to be accessed on systems. Some hospitals have, so we can connect to those hardwares and make those data available to the tablet. We'll have a cloud-based backend connected to that system, and the thing can be accessed on tablet. And I'm glad to inform that in India we are the only company which are doing this thing on tablets. There are 3 others which are based in US, but not in India. We have got a chance to present our this product in USA in a conference of Organization Radiologists Society of North America. And then yesterday, as I talked about the remote ICU monitor, this is also available as an additional to this tool. Then this My Health on the Go is from the patient's perspective. So patient can access their data anywhere, as I can say. Then they can read their profile, updated profiles every time. Then if they want to consult some other doctors, no need to carry huge bundle of documents with them and show that to doctor. They can simply carry their tablet device or their mobile phones and show it to the doctors. Then insurance processes and all, it gets very easy with a proper organized data. And appointments, if there is a change, they can get an updated information based on that, and other health informations. And our social responsibility, it's like go green. If there is a paperless prescription, the use of paper is less. Then we are trying to replace the infrastructure part with the cloud-based applications. And telemedicine and telehealth, we are trying to increase, and even the medical tourism. And this is about our delivery mechanism. Initially, we started with directly talking to doctors, and we have got a very good response. And even in Delhi, we are talking to doctors directly, but that channel is, let's say, it's not very productive. The time consumption is very high. So what we are trying to do, we are trying to give the licensing through other channels, let's say in pharma companies and medical associations. We are already in talks with IMA, and we have got approval from IAP and FPA. And this support is 24x7 support is available via tutorials and online conferencing and chat if required. So this is our traction, this data. Time's up. This is our data based on, it's the initial data when we did our run in Bangalore. 600 plus doctors are already using it in Bangalore. Then we are engaged with large pharma companies and, as I said, medical associations, and we are in good terms with Samsung and Apple for our OEM supplies. So, and the conclusion part, the mobility is there, then patient focused healthcare is there. The healthcare, the workflow efficiency is quite improved, and even the diagnosis accuracy. This last point I'd like to elaborate a little. What it does whenever we feed a data, a diagnosis, let's say some features, what the patient is there, the symptoms we feed in, it gives an option of some probable things. Based on we have some good consultants on board, doctor consultants. They have suggested it, so it can give it. So that's the thing, and I would be glad to answer some questions. Sir, it is. I told you it's 20K. It's one-time payment. Yeah, that's with tablet. Yeah, without tablet, it's yeah, it's 10,999. It's 9999, 10,000. Yeah. Yes, sir. So not diagnostics, diagnosis. Yeah, diagnosis. I said. Yeah, diagnosis. I said. Yeah. So just like that, sometimes it happens. I have some doctors in my family. It's like if they are not very focused, means it happens with myself itself. Like when they prescribed me a tablet, it was supposed to be once in 7 days, and they prescribed me for twice in per day for 7 days. So that was a total disaster for me. My liver was almost blown out. So in that case, what it will do, whenever we are trying to give things, it gives suggestions. So if some suggestion is in front of you, the chances of making a mistake is very less. Yeah, it is not exactly it's not a very big database, but yes, we are trying to accommodate as much as possible and updating with time. The doctors, even after the doctors buy it, they will get these things through updates. If you are buying a tablet version, it is on the tablet, and which gets updated time to time, but the web version, it's there. Yeah.
What about the issues of patient details held in a cloud? What about confidential patient details held in a cloud?
Yeah, that's a good question.
Have you had any objections or people worried about that?
See, the access is in particular user based, so only the patient can access. It will be provided with a mobile number and a password. Fine. If you are thinking some other person can access, it's not like that. The data will be encrypted at very high level. We have, I guess, 256-bit encryption with us. It's our own patented technology. We are doing with that. Yeah, no, bro. Yeah, the data is protected. That's not a problem.
But I was leading you to this suggestion. Get in touch with the and dispenser, whereas a paperless prescription is dispensable. That means the dispenser should be authorized to give the medicine to the prescription. E-prescription.
I'll say, let's say
the doctor is giving. I told you, I give you as a patient, I can access my data.
Makes sense. You want to buy medicine.
I
Go to a
guess,
store.
yeah.
Get me a signed doctor's prescription. Otherwise, I can't. Otherwise, I'll be penalized.
That is the thing.
But this is one of the authorized way of prescribing medicine. Then the pharmacist can get it.
See, things are working on gradually, right? So, yeah, yes, that is the thing that you are actually doing the right thing.
In regards to the information, will the user be able to, for example, if another vendor brings out something else, could I take my information and put everything into the new vendor, or will you be holding all the information and keep me there for the rest of my life? If you, so say another company brought out something similar, I liked it, could I now take all my information previously and all my records and transfer it easily to another vendor? Would I have that option?
Yes, I think that can be done.
I'm
not very sure because I've not seen.
Determined by your license conditions. It's not that you can decide. You can't decide.
As per US laws, a patient has the is authorized.
What we call as portable.
But
Your license.
but not in all the
question
countries.
is whether your license has portability of the data or not.
See, we have that facility that if a patient is having data somewhere, if a doctor is having data somewhere else, he can.
No, the data with you. Data somewhere he can always bring to you. Data which you have, based on the web connectivity which we are given him, can he take that data to another competitor of yours?
First, I would like to have a competitor in this area. I see.
Yeah.
No, I'm not saying there will be no competitor because I have seen one here. I have seen one here. Yeah. Yes. Yeah, obviously. Yeah. Yeah. Yeah, obviously. It's not that. And so, as that part, the paperless part you asked, right? One thing I'd like to clear. See, if when there is a record, overall record, everything is means on the file. You get a very thick file for everything. But if you want just a prescription, you can print the prescription. But even then, we are saving a lot of paper in terms of other things, right? The option for printing is always there. Yeah. That's what do you think that I agree with that.